Hello, Brooklyn. I am your host, Dr. Balan. Welcome to the Medcastplus show. On this show, we feature local physicians and healthcare providers who will share their expertise with us to help us become a healthier community. Today, I have our guest, Dr. Stephan Balan. He is the Chief of Hematology-Oncology at Mount Sinai, Brooklyn, located in the Midwood area of Brooklyn. Dr. Stephan is an expert in his field and is here today to talk a bit more about the fields of hematology-oncology, the study of the blood and of cancers. We have a problem here in Brooklyn, a healthcare disparity problem. There is more cancer here, and access to care is sometimes harder for our population. Dr. Balan and I will talk today about hematology-oncology and the services that are available to our own residents here in Brooklyn without leaving the borough. Dr. Balan, thank you so much for coming on our show. It is just an honor to have you here.
Thank you for inviting me.
So Dr. Balan and I work together over at Mount Sinai, Brooklyn, and I was just so honored when he accepted my invitation to come on this show, because cancer care and cancer prevention is key to the health of our community. And we're going to talk about that today. And we're also going to talk a little bit about Dr. Balan. So first, introduce to our viewers a little bit about yourself. Where do you come from? And tell us a bit about your education here in the States and what it is to become a hematologist and an oncologist.
Thank you. I was born in Bucharest. I'm originally from Romania. Actually, I came to the US in 1996, but just before I left, I started a fellowship in GI. And I came to New York, and in New York I went to do my internal medicine residency and then fellowship at NYU. I left New York in 2003 when I started working in New England at Dartmouth, where I spent 10 years in different settings. After I came back to New York for NYU, and then most recently, 2 years ago, I moved to Mount Sinai.
So here you are, back in New York. You spent some time in New England. It was too cold. You came back to New York,
Yes.
Right? And it's important because you came back to an area of New York City that could really use your expertise. Cancer care, when I see patients, they often feel they have to go to Manhattan. They can't access care here in Brooklyn. But this is not true. Tell us a little bit about what Mount Sinai is doing here in Brooklyn to provide comprehensive cancer care to the residents of the borough.
So, as you know, Mount Sinai has now a hospital on Kings Highway, which is the old Kings Highway Hospital. And we have two oncology clinics, one in Sheepshead Bay and another one next to the hospital at 3131 Kings Highway. In this clinic, we have 7 chemo chairs and a full-fledged team, and we offer really the latest in terms of cancer care. We see hematology patients, we treat blood diseases, cancers, we give chemotherapy, we give immunotherapy, and hopefully we'll have some chance to talk a little bit about it. And we also offer blood transfusions. In the past, patients had to be admitted or to go to the emergency room and spend 8 hours waiting to be seen. Now they can just come to the clinic and have their blood transfusions there. We also give a vast array of therapeutics for Crohn's disease, for hematological cases, for all kinds.
You mentioned an important area of medicine, which is infusion. You mentioned chairs to infuse. And so for our viewers out there, explain to them a little bit what an infusion center is.
An infusion center is a place where patients come, they are roomed, they have their blood work done in the infusion center, they meet the physicians, they get their physical exam done, and then they, in case they need blood transfusion or therapeutics or chemotherapies, they go in a chemo bay, which is as comfortable as it gets.
I've seen this, and
yes.
it really is beautiful. The facility that Mount Sinai has built over on Kings Highway, the infusion center, the chairs are not really a chair. It's not what you would think of sitting in a doctor's office. They are recliners, they are comfortable, where patients can receive all sorts of infusions, whether it's iron infusion, blood, in a comfortable, clean setting, modern. From what I saw, it is state of the art.
It is indeed, and they have their own privacy. They have also space for a loved one to be with them. They have their own TV and spend their time in a nicer way than usual.
Right, because when I talk to patients sometimes, and we're talking about their diagnosis of cancer, there is still the thought out there that cancer care requires that someone be admitted to a hospital, that someone has to be in a hospital to get chemotherapy, that someone has to be in a hospital to get their treatments. But now, 2018, here in Brooklyn, New York, that's not the case. Cancer care has changed. Tell us a bit.
It has changed a lot. Patients in the past had to be admitted often to get their chemotherapies, and nobody wants to be in the hospital. Nobody wants to eat hospital food, no matter how good it is. Besides, you don't sleep well, everything is beeping all the time. There's also the risk of getting infections. It's a hospital after all. Now patients come to the clinic, they have their pre-medications to prevent allergic reactions and nausea and other reactions. And then they get the chemotherapy, and then they go home. It's a day like any other.
And they're getting state-of-the-art chemotherapy here in Brooklyn. The patients don't have to travel. I have so many patients who say to me, okay, thank you for finding my colon cancer. I'm going to now have to cross the river or go over a bridge in order to get the most modern cancer care. And that's just not true anymore. And they're surprised to find that you have a facility like this in Brooklyn, which is fabulous. So we talk a little bit here about what facilities are available to help treat patients who need infusions or cancer care here in Brooklyn, but let's back up a couple steps. Cancer prevention is more important. What can we do to prevent cancer? Now, there are certain cancers out there that we could screen for: colon cancer, breast cancer. Let's go over some guidelines or go over some recommendations. For our viewers today, it is important to understand that cancer should not be a diagnosis, but we should start as cancer being prevented. What are some tips that you have for patients who are healthy at home, worried about cancer? When should they start to get screened for some of the most common cancers, and what can we do for them?
There are several cancers that we can prevent. One of them is cervical cancer. We have now a vaccine that prevents practically cervical cancer. This has been an extraordinary change in the way we deal with.
This is the human papilloma virus vaccine,
Yes.
specifically for cervical cancer in females. The cervix is a part of the female reproductive organs. It's at the bottom of the uterus and the vaginal canal. And what Dr. Balan is referring to is a vaccine that is now available and recommended for women and children. Female,
Right.
starting at in their teens, I believe, or
Yes.
young age.
Another cancer that you know more than I do in terms of prevention, it's colon cancer.
Right.
Nowadays you do the colonoscopies not just to detect cancer before it becomes symptomatic, but also to find polyps, things that can become cancer down the line. This is prevention.
Colon cancer these days is preventable. Patients come in and ask what are their options for screening, and we go over some of the options, and we talk about the dramatic drop we see in colon cancer in older people, people over the age of 50. The issue now is we are seeing a bit more colon cancer in the younger folks, somewhere in the 40s, and so the recommendations are shifting somewhat right now. Some of the organizations have come out and recommended that the colon get checked at 45 instead of 50. And very important for our viewers, the recommendation for African Americans is to start at 45. Other populations is still 50 years old, but the American Cancer Society has shifted and said, hey, listen, we should start checking at 45. So cervical cancer, colon cancer, these are preventable. What else should our viewers be looking out for?
The best advice I have is just to give up smoking, and that would probably prevent a lot of cancer.
Put a lot of doctors out of business if
Yes.
smoking didn't exist.
And some companies also.
Right.
When you look at the curves of incidence of cancer and the survival, they're all moving in the right direction. And one of the major factors has been to give up smoking. This being said, you have screening tests, and you mentioned a couple. Another one is for prostate cancer. Just very recently, the national guidelines have changed a little when it comes to prostate cancer. We used to screen everybody by doing a blood test and to look at a PSA, and nowadays we're not very sure if everybody benefits from that.
But that really is on an individual basis.
Yes.
You know, for the men watching today, I always recommend to my patients, see the urologist, see your primary care doctor. Depending on what illnesses you might have or how healthy you are, they will find the right screening method and treatment method for you. But that's a big one. Men ask a lot about prostate cancer, and there has been some debate about how we should screen for that. You're right.
Right. And there needs to be an informed decision. It needs to be an in-depth discussion. And that's one of the nice things we do with a newly opened cancer center, is that we have the luxury of sitting down with patients and explaining them and involving them in making their own decisions. To be tested for prostate cancer is really an individual basis. Depends on your family history. Of course, if you're an African American, then you are at risk of developing prostate cancer early on and to have a more virulent type of cancer.
African Americans, like with colon cancer, we screen them a bit earlier because, yes, we do find things in the colon at a bit advanced stage compared to the average population. So the same with African Americans and prostate is what you're saying. And that's, you know, these are important factors. Is that for our viewers today, when you see guidelines, they apply to a large population, but when you sit down with a doctor like Dr. Balan or your primary care doctor, they can individualize the approach. So it's important not just to read online about a guideline, but to discuss it with the physician, get into the doctor's office and have an individualized discussion.
And this is very important because there's also a downside of overdiagnosing and over-treating. I worked at Dartmouth, among other people, with Lisa Schwartz, and I was very saddened to see an obituary in the New York Times yesterday. She was she died at a young age, at 55, of cancer, and she was a great advocate about empowering the patients and getting to know as a patient what's your risk to develop a cancer, to prevent it, to treat it, to die of it. But without an informed, it's not an industry. You're not on an assembly line. Everybody comes in, gets their PSAs. It needs to have a discussion.
Every patient is different.
Yes,
you know, the conversation with a physician is the most important part of healthcare because, you know, patients go online, they Google, they search on Yahoo, they search on the websites, and while it's good because we want our patients to be as informed as possible, there are studies in screening, there are studies in treating cancers that say for certain populations we should do A, B, C, and for another population X, Y, Z. And that's where your expertise is so important. So we talked a bit about prostate, colon, cervical, preventable and treatable cancers for the most part.
Cancer.
Lung cancer. Let's talk, you mentioned smoking. And here we are in Brooklyn. I know I get on the subway outside, people are smoking cigarettes. Outside the malls, they're standing there smoking cigarettes. Outside of a restaurant, smoking cigarettes. And it just kills me because this is preventable by just not picking up a pack of cigarettes. What can we do for smokers in terms of lung cancer if they already are smokers? What can we do aside from quitting smoking?